This is Janine. And thank you, Nakia, for getting the recording started. We are so excited to host Dr. Ellie Kazemi today in our 19th scope, today titled How Can Artificial Intelligence, or AI, Shape the Future of Immersive Learning and Practice of Speech Pathology and Behavior Analysis? We've agreed to keep the intro brief so that we can get as much content from Dr. Kazemi as possible, but I want to note that she is a well-known speaker across a number of topics and is the founder of the graduate program in behavior analysis at Cal State University Northridge, as well as the director of AI, VR, and AR initiatives. I also want to note Dr. Kazemi is teaching directly after this presentation. So we will need to end promptly at 20 past. So we'll have about an hour of learning from her and then about 20 minutes for a Q&A. And we'll kind of do a transition to that, but feel free to note questions in the chat. We'll keep track of those as well. I will pass it over to you, Dr. Kazemi. Thank you so much for joining us.
Thank you so much for having me. It is truly an honor to be among you, and I want to reach over and hug Lena and Tammy and Ling, and I feel like I'm among very dear friends, and this is so exciting. I have to admit that I have been in this area for some time, but each time you're asked to talk about the topic, so much is happening every day in this space that I literally sat down and redid lots and lots of my talk. So, I knew this would be the right group to come and talk with about this. I'm excited to have these discussions. I say this because I'd like for this to be as interactive as possible. I've made a bunch of slides to show you what's out there, but really what I need is to continue to engage you and hear from you and to learn what your experiences are. And I can do that through the chat. I can manage the chat, and I have a few questions here for you that I'm going to engage you through the poll throughout today. But, feel free to stop me, feel free to go off and unmute yourself and talk to me. I need the audience. I don't do well in my little Ellie silo world. I need to know how you're thinking, what you're learning, and we're going to learn here together because there's definitely a lot of information out there, and I'm sure many of you know many things that I could learn from you about. I'm going to share my slide here. Let me see if I can just do it this way, actually. And how's that? Do you all see my slides? Do you see yourselves as well, or is it just my slides for today?
I see both.
You see yourselves as well? Okay,
yeah.
So maybe what I can do is I can really quickly shift and do a different one. I'm working here from my office. So how's that? Just the slides, hopefully, this time around?
Yes, it's all good. Slides and us, it's going to stay that way. We see the slide.
Okay.
We see yeah.
Okay.
The slideshow is, yeah.
Perfect. I just don't want you to be bothered by all the chats and everything else on my screen. I'm going to begin with a very bold statement here today. We are in a world where technology is shaping every fabric of our interactions with each other today. And we are at the brink of a revolution in human services as well as many other professions. We are at a space where artificial intelligence and immersive experiences are about to redefine everything we do and change the world as we understand it today. And I've looked into how that will be defined, how that will actually impact the field of speech pathology and behavior analysis. But I'm going to begin with, it is here. It will revolutionize what we do. It is already changing things, and the world as we know it today will no longer exist. I'm going to begin with that today. I do have a unique lens and a bias in saying this. I probably have been ahead of the game in saying this is going to be here, this is going to be here, everyone, it's going to be here. And then before, ChatGPT became accessible to the public, I think people may have just thought I was a little insane or a little nerdy or cool. And I have this unique lens where I've been leveraging technology for some time because I have a father who is holding that teacup. He's standing right next to my husband, who is a civil engineer. And my father was my primary caretaker as I grew up. I was always in his office working with him with AutoCAD and advanced technologies, as he used technology to really advance what he was doing as an engineer. So even though I selected a field in social sciences and human care services, the technology aspects, the engineer has always stayed with me. And my father is truly my confidant and my first and primary mentor. So he continues to influence my way of thinking about things. So the world of merging technology, merging engineering has really come naturally for me. And that's my context, which is why I think I've always been interested in this area. The other thing is that I did not find behavior analysis through a traditional route. I went to UCLA and received my doctoral training in clinical psychology and did a lot of work in psychometrics and clinical therapy prior to finding behavior analysis, actually. And that has really influenced the way I look at our field from a perspective of needing to scale up and to match to other professions in human care services. I'm among colleagues here that truly understand what I mean by that, because when you found behavior analysis early in life, you may really just know about that until you get exposed to other things. For those of us who found behavior analysis, post a different certification or a degree, we come to it with a different perspective. We really use the science and understand what we're coming to very differently, I think. So I share that with all of you, I think, who are members of this organization. And Sophie shared this, but my other unique perspective is that, I am trained as an academic. I originally started as an academic, and I still continue to have a position as a faculty member at Cal State Northridge. I founded the master's program in applied behavior analysis, and that has really influenced the way I think about training the next generation of behavior analysts and how we think about our workforce. Because I've done a lot of training either in the community, or I've done a lot of training with internationally, trying to figure out how to advance and scale up training as quickly as I can, because we can see that our interns or our students don't get the type of internship they need, the type of supervision they need. And that's really actually a lot of why I did the work I did at BHCOE when I was with them, and a lot of the reason I wrote the book. It's always been around quality control and how do I help people really in that aspect of things. This context influences my need and desire for the statement I made, that I believe it's here and we're about to change the game. And I'm going to speak from that lens. The other thing I want to share very briefly is I've been doing this work for some time. For the past 15 years, I've devoted my life to advancing what we do through technology. I have gone as far as taking on a humanoid robot to act the part of a child with problem behaviors, to see if I can simulate training and teach individuals in simulations. I have worked on simulations in the work that I did with NASA, as well as the fire department. So I've been in this space thinking, how do we do simulations well for some time? So some of the things I'm going to share with you today come from that experience, but also are super exciting for me because with the newer advancements in digital computer technology, or computer technology actually itself, we're able to do some of the things we were not able to really do just 5 years ago. And so it's pretty exciting where we can be next. At the end of the day, though, I'm a behavior analyst. Finding behavior analysis changed my world. And I come to all of these perspectives with the same perspective you have, which is that behavior is a function of its circumstances. So, what is coming for us as far as technology is concerned will shape our future, because it will influence, it will be available, it will reduce effort. How we will behave in its presence is completely still through the principles of what we understand. The principles don't go out the window. So everything that I'm thinking about when it comes to the technology and what it will do to our society, to learning processes, to education, to our field, I still have that mindset that, well, behavior is a function of its consequences. If it's easier, we're gonna turn to it. And if it makes more money, the corporate world's gonna turn to it. It's sort of like the way I think about my world. And of course, you know, I'm sort of guided by Skinner's teaching machines and a view he had for what we could do for education, which I think is now possible more than ever. And that is that we can really create personalized systems and allow for experiential learning to be fun and for it to be efficient, because we don't need individuals to get feedback from an instructor at all times. We can really create worlds to develop learning in a different way. So I'm very excited about all of these possibilities. One of the things that I want to do today is to really share with you a vision of a technology-enhanced future. Sometimes I get the question of, Ellie, will robots take over our jobs, and will artificial intelligence take over our jobs? And I actually do not think that that's our near or very far future. I don't think that the level of subject expertise and content expertise you have and the level of human care experience you have will be replaced. But I do think some very cool things are coming in the near future for us. If they're not already, some of these things are already here. In the very near future, it's likely that we will have accessible care. So, you know, a family that may live in the middle of the willows and may not be very close to a hospital or a clinic setting will have full access to, you know, someone who's providing human care services, a speech pathologist who also has behavior analysis training, who's a behavior analyst in, you know, in the field, providing communication, social skills to individuals that may, you know, need it. What I think we'll likely see is that these individuals will be able to use objective assessments. So they're going to be able to use Padlets and smartphones to be able to do some speech tests, objective tests, and get those results prior to showing up or even seeing the client. I think we're going to see the capacity for clinicians to create personalized exercises, to sit down and really think about the profile of their clients and select things for them to do that will not be paper and pencil, that will not create a lot of labor to develop, but will be something that they can drag and drop into you know, various device use for them to use. I think that what we're going to see is something we've all envisioned and wished for and loved, but are not able to keep up with, which is ongoing measurement of our influence and our impact and ongoing growth. And visualization of data today is so easy for so many of these chatbots. So we're going to be able to monitor and be able to see what's going on. And we're likely to also see a clinician who is leveraging technology be able to create efficient documentation, use voice digital systems to make notes, even ongoing during therapy to be able to indicate what things that need to be taken care of or documented or needed. And all of that could be done digitally. So I see a world where we can actually see much more efficient and accessible care through the use of virtual reality systems, Padlets, and smartphone devices that are artificially assisted. For the client, I think what we're likely to see is that they're going to be able to access early identification. There are lots of individuals still waiting. There aren't enough qualified professionals out there to be able to do the identifications and diagnoses. And we're going to be able to get some assistance through those objective assessments. For the clients, we're going to be able to see ongoing treatments when someone's not available to drive out to the middle of a willow to provide that care or make them drive out to them, that they're going to be able to do exercises and, you know, undergo treatment independent of the clinician needing to be present at all times. For the client, they're likely to access personalized activities that completely immerse them in a world that's personalized for them based on their experiences and even potentially their own things in that immersed world. And we're likely to see that learning can be fun, even more fun than we try to make it today as clinicians, such that they're able to really have gamification and access to things that may not seem like education per se. And you know, every time I say that, I think most of us have learned through nothing but fun, right? That isn't play fun. That's how we're supposed to learn. Best of all, we're likely to see things become much more accessible for many more clients. And I think that these are some very near possibilities for the future of what we're likely to see. Now, I'd love to know a little bit about you as an audience, so that I can open the discussion and know who I'm speaking with. To do that, I'm going to do a few polls, and then I'd love to hear from you personally. I'm going to open a poll. Let me see if this will work. And I would love for you to see if you can answer the questions based on what's on my slide. Yay, I get to see them before you do. Yeah, I'm glad I did this. I can definitely see this audience is very savvy. Very, very cool. I'm gonna close the poll here in a second and share the results. So we can see 30% of you said weekly, 25% said monthly. And then there is obviously a good spread between daily and some of you said rarely and never. But for the most part, most of the individuals fall somewhere between B and C, weekly or monthly. And we still have individuals who have not gotten introduced to this topic. Now, I'm going to stop sharing here, hopefully, and take this away. The next thing I wanted to know about you is in which areas of your life, for those of you who are using it, would you say you're using AI? So let me see if I can actually relaunch this poll. Okay. I'm seeing lots of A's there coming in. A few B's.
Ellie, you can't select multiple.
No, sorry. You know, I'm not, send me some feedback, Tammy. Did you want to say work and home or yeah, that would make sense.
Yeah, work and home and entertainment and
All of the above.
health
Yes.
and fitness.
Yeah, all of the above. That sounds like a good option as well. So here are the results I got. It looks like many of you said A. Out of curiosity, how many of you would have said all of the above? Maybe not entertainment. Okay, cool, Barb. Cool. Yeah, couldn't live without it now, Tracy. Yep, I agree. Very cool. Ling, I'm not surprised. Very cool. So, you know, it sort of shows us that it's spread and it's not in a particular area. I think this itself is a great example of how AI is not restricted or specific to ChatGPT, particularly. It certainly is now spread across everything we do with web development, and a lot of the applications and tools we're using today are actually already artificially intelligent. And then last but not least, I just wanted to know how many of you are actually, you know, familiar with virtual reality, given the number of things that are available for speech and language therapy today. So I wondered if any of you have used the headset or have been in a headset. Cool. Very nice. Cool. Thanks, Tim. What are some of the experiences you have with AR and VR?
Hi there. My name is Bisa Peterson. I'm a colleague of Dr. Timothy Wow. And as a matter of we are building a VR headset called iView at Microtron AI. And also we're creating a immersive marketplace. So it's essentially an app store, but for the VR and metaverse.
Fun. Very cool. I am glad to meet you. I look forward to continuing to speak with you about this. I'd love to hear your feedback after this talk as well. Very, very cool.
Definitely.
Excellent. So you can see here, actually from this poll, that quite a few of you have been introduced to the headset through a family member. And you've been in a headset either at an event, some of you probably through some of the commercial systems that are coming into this space. And, you know, about 6 of you said that you've actually never been in a headset. And this kind of tells me a little bit about our audience here. This is a savvy audience. Really, actually, you know, your use of AI is already at the early adoption space. So you're already beginning to adopt quickly. And quite a few of you have already experienced VR. And this is pretty cool. It helps me with some of the things I have today. Because the current landscape of this field is moving quickly. So what I'm showing you today as current will be old tomorrow. That's just how things are moving. And even though I've been in this space for some time, I definitely feel it. And I can say upfront that the 5 ways I can see any of us using, you know, AI and XR tools. XR simply is the overarching term for virtual reality as well as any augmented reality systems. It's the overarching name for all of those that you actually can use it for any kind of assessment. I'm going to show you some of those today, but I try not to advertise other companies. I just want you to know that there are assessment tools out there for being able to do speech recognition, and you know, they still require training from you. You can also use it for some intervention. You can absolutely already use it to create scenarios or to create some of your a list of you know, words with a particular sound if you wish to put that as a part of your programming and training. But you can also use it to create interventions such that the individual sits across the screen and engages in some of these activities outside of you. There's already systems in place for that. As well as assistive technology that I'm going to kind of show you, but you have a member here that I can see is probably you're all familiar with some of the work that she's doing. The other things that you can use AI for is administrative and operations so that you can make things much more efficient as you're writing notes or following up with patients or clients. You can also administratively do things like put in your email into something like ChatGPT and say, can you check my tone? I want to, you know, I want to double check to make sure that I'm not coming off emotionally defensive. So you can literally have an assistance in double checking some of your information or some of your things that you put out. You can also give it some ideas and say, I'm trying to draft such a such letter to such and such person. I don't feel that this flows. Can you help me make it flow better? So you can absolutely use it for administrative and writing tools. You can also use it for staff development and training. I'm going to show you there's already some virtual reality trainings that are coming into this space, and there's already been some interventions of individuals, particularly individuals who stutter, that are using some of this for intervention purposes. Sophie seems to know about that. And then last but not least, any of you who have your own organizations or are entrepreneurs, I think it's a huge help when it comes to things like marketing. It can develop images and information for you. And in fact, today, almost all of the things I use have been developed through some kind of an artificially intelligent generative system. And I've usually provided credits at the bottom. You can also have it help you write blogs or post or suggest what else to put out there. So it can really help with all of these areas just upfront. Are there other areas that I didn't think of that any of you are currently using it for that you think the group should be aware of?
I used it for almost all of Weba's social media to for the conference for July. All the introduction to the speakers, excuse me,
Wonderful.
what to do about in Atlanta, excuse me, all kinds of things. And it made, and you're right, I was able to say, make this an upbeat post for social media, for women in behavior analysis, focusing on women-owned businesses to frequent in Atlanta. And it
I
was
love it.
pretty amazing when it came out. I was like, wow, I'm in
Mhm.
love.
Yeah, absolutely. And think of the time savings. I think, Nikia, what you come up with is already very impressive. You're a marketing genius and you really know how to make things relatable and accessible. But now that sounds like you just became that much more efficient in being able to
Yes.
put
And
your work to good tasks.
and
Yeah.
in therapy, it was interesting too. I used the Bing image creator with a student, and I said, give me all the things that you would like to see in this picture, but I want it to be about a little girl playing a piano. But you have to give me a bunch. So she said, this is what she said. She said, create a Pixar picture of an Indian little girl playing piano for runaway dogs in Bangalore. And the image was astounding. I mean,
Wow.
I was shocked. It was so great. Looked like
I
she
love
should have been
that.
in a Pixar movie.
I love that. I'm going to share with you a little bit of some of my challenges and using some of the image things. So I'd love to hear from you if you've had any of those when I share them today as well. I can see in the chat other people brought up some really good points. I honestly no longer take minutes. I use an AI assist to do that during all my meetings and action items and then generate it around. It looks like some of you use Zoom for that. Others have brought up that they have it summarize articles for them. I also use some artificially intelligent generative systems that are specific for looking for academic journals and peer-reviewed articles to double check to see if I've caught everything that I've reviewed. So I can see many of you are already using it for some of those. So those are excellent points. I encourage you to never take notes during meetings again, because those systems can easily be trained and are fantastic for use. And lesson plans, Anne says she uses them for writing lesson plans and some of those things that she's trying to do for learners. So that's wonderful. So some quick examples of what's out there is, there are speech recognition tools. Speech recognition is incredible today. And, we are definitely moving to a space where people are interested in coming up with devices and things to help individuals with speech disabilities. And I know Voice It is one that's definitely trying that. There's assistive technology. Shout out to Ling and her effort on Lingo. This is the type of revolutionary thing that I think is going to be changing what we do as professionals so that we're not spending time guessing. It's personalizing information for individuals and clients, and the training is amazing. We're also likely to see other things such as Project Euphonia that Google's been training. So these are systems to try to recognize very difficult to understand speech for individuals, and we're likely to see smartphone devices and other things begin to embed some of these things. And if you're interested, I thought maybe I would play these videos, but I actually would rather have some of these conversations with you today, but all of these are available as videos. The other thing that's available is I noticed a lot of things for individuals who stutter. This is a large need in individuals who are either in leadership positions or public speaking positions and really have difficulty in being able to communicate, and that social anxiety and their stuttering can really impede their growth. The interesting thing about this is that this article that I'm showing you here was actually done in 2015, and virtual reality has been here for some time. Certainly, we were doing some work at that time in the space, but as early as 2015, there was some evidence of being able to do some remediation and target specific behaviors for remediation for these individuals. For any of you interested, there's also virtual reality, for individuals with traumatic brain injury. And so there are things that you can look at and demo today. And this article is actually looking at the views of speech and language therapists, and I'll be AI for you. I'll shorten it and say they liked it. They had some reservations about certain things and some cautions we're going to talk about. But in general, speech and language therapists felt that this could definitely speed things up and make it easier to provide care for these individuals. Now, I'm talking about virtual reality and artificial intelligence almost synonymously. So I want to pause here for a moment and explain that artificial intelligence is this broad thing. It's, the synthesis of data. And it is, through artificial intelligence that you can have generative things such as chatbots that can provide you with answers, like ChatGPT. You can go in there and say, rewrite my things or think about what I'm writing. Or you can actually have devices or other things that are artificially intelligent, such as the assistive technology that Lingo has put together. Or today, in the space of virtual reality, which is just immersive learning, it's a visual overlay of your world, you actually can have systems that are artificially intelligent. So now your avatars can be dynamic and speak back to you at the same time. You can create scenarios at a much higher speed. So I use these interchangeably because the advent and the progress in artificial intelligence has immediately had impact on virtual reality. And that's the space I'm in, is in the space of immersive learning. And so I'm going to share some of those things with you, but that's really where education and service, human care services is likely to be influenced. Lastly, there is a review of virtual reality technologies if you're interested in the area of communication disabilities. This was done by Bryant about a year ago, a very solid review where they looked to see if some of the things that they have some of the virtual realities modules that have been developed are effective, and in general, they found, similarly to the paper we published in behavior analysis, they found it to be generally effective and for skills to generalize. And again, there are some things to be aware of and to think about as we move forward, which I'm going to talk with you about shortly. But this is where we are. There are some absolutely teams who have developed some of these, and virtual reality spaces here now. When it comes to artificially assisted systems, there's also mobile devices and mobile systems that have been created. Again, I don't work for Constant Therapy. I don't have a particular contract with them. I do advise on the Lingo team, and so I have that as a conflict of interest. But I do not work with any of these other companies I'm showing you. I'm showing them to you as examples of what exists out there today. So here is this at-home speech, cognitive, and language therapy that you can access as a patient. I have not personally used it because I could not use it without paying for it, but it does seem to be downloaded on your phone, and it recognizes your speech and provides you with immediate feedback and whatnot. So I encourage you to look at systems like this as possibilities of what's coming. I know something is here to stay when universities begin to embed it within their graduate programs, and it takes a lot to change graduate programs to have such coursework. And I was not surprised to find that already there's speech pathology graduate programs that have AI coursework, and some that are already showing how to use AI as a part of the therapeutic relationship for both assessment and intervention. So this is, you know, something that tells me it is definitely here, and the next generation of individuals are going to be learning to use them. For those of you at all interested in stuttering or interested in supporting entrepreneurs that are out there, again, I don't have a particular relationship with this gentleman, but Gareth Walcom came up quite often during my searches and interests in this particular area. Gareth himself stutters and is very committed as an engineer to develop something that would really make a difference in this area for these individuals. And so he's already developed lots of modules and has a virtual reality system that he is very interested in. I will talk a little bit about what these contents mean as we move forward in our field, but you know, if this is an area of interest for you, I think you definitely would want to be on the lookout for some of the work that he's doing. Any of you know Gareth? Am I telling you something that you already knew? Are you all aware of some of this work? Is this at all interesting and up the alley of what you want? Okay, okay. I wanted to know if you were interested in some of that. I also found this that I thought super interesting. I don't know if you're familiar with Jessica, but Jessica puts together these beautiful episodes about what's coming and you know, future of what's coming to speech and language therapy. And I loved this episode on how to integrate virtual reality into speech therapy. And in it, she does very similarly to what I did, which is to really talk about AI and VR at the same time, because these worlds are all merging together. The VR is really just the device, so no different than your computer or a mobile phone. It is just really a device that allows for visual access to information. And so she talks a little bit about some of the ways that this is being used by different speech and language therapists today. So I thought that would be interesting. I also found she had a few other episodes that were very cool. So if you don't know about her, I definitely would look that up. And I think, Nikia, you mentioned this, but you know, today there are various tools you can completely play with and use for free. In fact, you can get you know, points for using them. They're trying to encourage and they're training the system. So there is AI Test Kitchen, which is a pretty cool artsy, you know, tool that you can go into and create different images and change your images if you're interested in developing different imagery, either for your slides, if you're an educator, or just for sessions or for fun, because you want to celebrate somebody's birthday and do that. Most of what I used today is actually Night Cafe, and this is another very easy to use system, and they use gamification, so they've got me hooked. So even though I use the other systems, they've got me hooked, because every day that I use it, I get this little email that says, "Good job, Ellie, you used this, so here's some credit you get for today." And then I get all excited that I have credit and I go and collect my credits and then keep using it. So, you know, it works to have created such a way to hook me in. The other thing that I really like about Night Cafe is you could actually feed it your own image of interest and then ask it to alter that image in various ways, because you want to use it for different things. Or you could also select particular items within an image and kind of change it. So I've actually not done that one myself, but I have used it throughout this presentation to them, and I'm going to show you again some of the challenges and good things about it. And then I don't know if any of you are familiar with DALL-E. DALL-E is you know, an easy to use free one as well. So these are some visual ones that you could use. Any of you use any of these? Care to share some of your experiences with maybe other tools that you have used that you suggest?
Hi, Ellie. I've used a few for work. You have to really watch what the output is because often it's pretty hilarious. It's kind of like Pictionary sometimes, but not drawn well. But it's interesting because what I work in an autism organization, and so we have to come up with some really good culturally sensitive images. And no matter what we've done, as soon as you say the word autism or autistic, you get puzzle pieces, even if you say no puzzle pieces. So we're having actually, it's interesting. I've got some new ones to look at now because we've had some real trouble trying to figure out how to use it and make it work for what we need. But yeah, some of them are dead on, like Nakia was saying, and others are so far off. It's it's kind of fun to do though.
100%. I'm going to show you some that I went through trial and error today to just get some of the images today. I couldn't agree more with you. It's interesting. Sometimes you get some things where you're like, huh? And also if you're trying to be culturally responsive, but also mindful of what you're using as images, you really have to take another look, which these are great points with regards to the caution. Other tools anybody has used that they think the team would benefit from knowing? No? Okay, I'm gonna go through a few more things here. But I do get lonely if you don't talk to me. I'm gonna open this one up and see how many of you are using actually any of these tools. Let me see if I can go ahead and relaunch the poll. Cool. Oh, Dream.io. Okay. Thank you. Thanks, Sammy Bead. I gotta look into these. Of course, I get the one pen that doesn't bite. Okay, very cool. So it looks like it's actually, I've never seen a poll where the results are 50-50, but that's really what happened. So some of you, 50% of you are using it, 50% of you have not been. That's very interesting. So I'm hoping to have inspired and gotten most of you to consider trying it if you've not tried some of these today. It's all about experimentation and having fun. And we just shared some of these tools that you're currently using. So what I want to do is to move to some of those conversations that you were just having about if you are using them, what is that, what are some things to be cautioned about? I do think that the ethics of the use of artificial intelligence, again, independent of device, mobile, computers, VR headsets, is really all the same. There are teams forming around this topic. I'm myself a member of the AI and ethics committee group that's formed. We have a group of behavior analysts, and anyone who would like to join us is welcome on this team. And what we're doing is really thinking about what are some of the guidelines we need to put together for behavior analysts as people begin to use artificial intelligence. The other group that we've heard is actually considering putting something together for practitioners is CASP. We recently met with them and talked with them about this. So they have been thinking about how to put something out for providers, particularly with organizations coming out with clinical decision trees, clinical recommendations, data analytics, and documentation changing that may have artificial intelligence components to it, or, what Ethan Mollick calls co-intelligence, meaning, as human beings, we're working together with artificially intelligent systems, that there are some things for us to consider and think about as we're moving forward in this world. So certainly, I think this is an important space for all of us to be in. I do think that we need to be mindful of the fact that there's a lot of bias. All artificial intelligences is a makeup of what exists currently as data we've collected. A lot of that data has, we have not thought about the function of that data. For example, if we even just think about medical data that's been collected, individuals, if I have one type of symptoms, my physician may actually note or provide other ones in a system to be able to give me the right diagnosis for the right medication. That type of data collection has been happening for all of us in all of our fields, where we are sort of collecting information, but what we may be submitting may be a little different, just because we're trying to revise things as much as we can to be able to help our patients along the way. And this has influenced the type of data that currently exists, and the systems are working from. The other thing is that most of the contributors of this data have historically been Caucasian men, and so we know that there isn't enough data, even when it comes to female menstrual cycles, for example. Literally, we just don't have enough information about what's happening for women during menopause. So there's a lot of things that currently we don't know. And it gets worse and worse when it comes to individuals who are non-binary. They're individuals who actually have transformed or are trans. So we just don't have enough data to be able to be good care providers quite yet. So it's important for us to know that the data is biased, meaning that our systems have been biased and we have not collected data with equity in mind and all the individuals in mind. And so we have to be aware of that as we are relying on some of these systems. The other thing is, I don't know if any of you have had this experience, but this actually happened to me, where my little niece fell down and seemed to have hurt her pinky. It was right after gymnastics, and she just was laughing and she fell over and hurt her pinky. And my brother-in-law took her in, they took an x-ray, and he got a notification immediately that, her finger is broken, that he should bring her in. And that wasn't actually an artificially assisted system that would view the x-ray. And so the first thing it did was tell him, bring her in, it's a broken finger. They wrapped it up. And lucky for him, the physician on call came over and looked at the report and then did further tests. So he asked my little niece, move your finger, move your arm. And he's like, this is not broken. And I think that really our training is going to change. Our awareness is going to have to change, such that we're going to be given a suggestion by the artificially intelligent system or, assistant. And now we're going to have to examine it for ourselves. So rather than being able to rely on these systems, we're going to have to train people to think above and beyond as they get this information for themselves and continue to rely on their clinical judgment for some of these things. Thankfully for him, we knew that Isla's finger was not broken, for example, but I was thinking, what that means for this physician. It means kind of looking at this report that says this is broken. X-rays are not easy to read. There is a gray area with x-rays, and for him to then be able to follow up and say, nah, that's not it, based on my clinical judgment. And I think that's exactly what's going to happen to us in our field, and we need to be aware of that. There's obviously privacy issues with the amount of data that we're all contributing will continue to be collected on our lives, and how that data will be used, who's able to buy it from whom. These are difficult things for us to have read all of the little things, and being able to control and understand those as we become a part of these systems is really important. As well as the security of the information, so that it doesn't harm the individuals we serve, and for ourselves as we continue to be contributors to a lot of this data. Every time we ask these questions, every time we ask for something, that data is being contributed to all of these systems. And then, of course, what our patients and families are consenting to, what does it mean? What are they going to get from us? How much of what they're getting is our intelligence versus that of a system? So, here's an example of a photo I generated because I was trying to generate the earlier photo to provide you with an example. And if you look at this photo very carefully, you will likely identify quite a few things that are very odd in this photo. Now, the prompt I gave to the Night Cafe is to provide me with a 5-year-old, because I had a scenario in mind of a 5-year-old Emma who lives in the Willow. And, you know, I asked for an androgynous biracial therapist. Now, why? That's the image I wanted. And you can see that is not what I got. And I received a third person in this image I never requested, by the way. And now beyond that, do you also identify other odd things in this image? I'm hoping you can all
Extra
see.
arm. Yes.
Yeah, there's
The legs, the feet, the arm in between her legs, like what? Yes.
right. And so this, I think, is a better example other than like some of the other things that, you know, I can share with you. For example, when I was working for the fire department, I wanted a firefighter who's a female, because all I was getting was white male firefighters as the images of individuals for all my slides. And when I made that request, it all of a sudden provided me with a very odd image. It was that difficult for it to generate something that I had not requested or had not been requested before. And I think it's really, and it was not contextually even in a place where a firefighter would be. So it just, you could tell that I had tripped it up all of a sudden over a request of something as simple as give me something other than what you typically have on the web, right? So I think that these are great examples of the types of things that AI is going to continue to make errors with. It's going to learn, and it's learning as we correct for and change things over time. But I do think it also has created a world where, you know, I think, Tracy, you brought this up earlier, which is really important, and that is the prompts we use matter. So now more than ever, you know, I'm a part of all these different groups and in Twitter where people actually share with you the prompts they're using or how they're changing their DALL-E images, how they're changing their night cafe images. So we've moved away from just using it to prompt sharing so that we have the tricks about what to say to AI, which really influences how we speak, right? Think about it. Our behavior is being shaped back. Like, here's how to tell AI what you need from it, right? So it's a very clear system of interactions there. And I think that that's absolutely here. And then the only other thing I want to do today, because I'm at time, is to call you all to lead and to a call to action. We are moving in this space. It's absolutely true. I do think some of you may be here, or you may be inundated with the amount of work you have and amount of stuff that's happening. And in my experience, when I talk with folks, this is common for myself as well. I can't seem to keep my head above waters, and yet things are happening every day. And so if this is you, if you can relate to this, you might want to carve out some time so that you can use the wheel, because it is going to be better. And then some of you may be in a space of a bit of fear. It's here, it's going to take over the world, it's going to take over me. And for those of you who may be there, I thought I would share with you how people responded to the calculator when it first came out to be used in public education. I do think calculators have changed our world. It absolutely has changed our world, but not to the effect that we thought, and definitely did not destroy our capacity to compute. So I think that these are important things for me to mention as a part of the call to action. Is it is here. I encourage you to experiment. I encourage you to get out of your comfort zone. And yes, be cautious, but absolutely be aware. A note on immersive learning. I'm really excited that Lena asked me to come here and speak with all of you. I have just launched my own company, Transform VXR, and I hope to be in a space of really taking immersive learning to a different space. I hope to give the people who are interested in creating virtual reality the most amount of control. So I'm not interested in creating just content and modules, but I really would like to create a world where you can go in and develop your own immersive world for your clients on a one-to-one basis. So if you're interested in some of the work we're doing, we've just begun and our team's ready and excited. We're beginning to meet with people just as of last week. Please let me know, give me a shout out. Here's some selected references I'm happy to share and send around. And here's how to get a hold of me if you're interested. Otherwise, I'd love to chat and hear your thoughts.
Thank you so much, Dr. Kazemi. I think we've had a lot of engagement and excitement in the chat tonight. And I feel like this went beyond my expectations, I can say, and I've got a lot of notes I've been taking on things I want to try out. It looks like I appreciate you ending right before the hour. If I think we have about 20 minutes for questions. If people want to, Dr. Kazemi, I don't know if you have a preference on kind of informal asking questions, or if you'd like that monitored with hand raises.
I am good with just informal. We're a small community. In my culture, we speak over each other. So
All right, thank you. Well, I will let our Q&A get started then, if anybody
thank you
has
so much.
anything you want to bring up.
Yeah. Thank you. Thank you all so much for your kind feedback, and please do provide me with feedback. This is a new space to be in. I want to make sure it's helpful to you. I take feedback as just your kindness to help me grow. So please feel free to let me know any thoughts you have.
Question, Ellie.
Yeah.
Hi, this is Anne. I put it in the chat, but you were presenting, so I've been really reluctant to use any kind of virtual reality because I can't even get through a 3D film. I can't go to IMAX, anything. Like, I have friends who have TVs that are so good. I get motion sick watching the television. So do you have any guidance for somebody like me? I mean, I guess I could try it and just get nauseous.
I do. I actually, no, I wouldn't say get in there and get nauseous anyway. Just like I wouldn't say if you have motion sickness, please go ahead and try a cruise after all. I don't think so. I do think the hardware is changing rapidly. So, the GoPro, for example, truly shows us the capacity for AR. And I wish I had some of these pictures on me, but really, if you just look at the development between 1995 to 2000 to currently, the shift in what the technology looks like and how you feel in the immersive world is incredible. Some of the things I can share with you is when people get into a headset, sometimes they get into an immediate game or an activity, and that immersive world is way just too much for them. So one of the things I've learned is to create a stationary setting. So I just, for example, I'm in this new role at the university where I'm introducing faculty and students to immersive worlds. And, I'm aware that a percentage of them is very much going to experience what you're stating. And so what we do is create stationary settings. And when they are in the world, they only get to move through teleporting and not through moving forward and backward at the beginning. So some of those things can really help you. Yeah. And then that way you can experience it, but not force yourself to experience it. Yeah.
I have a question, and I don't know if there's an answer to it, but anyway, you have presented this most brilliant, informative presentation and talked about, what AI does and what we can use it for and what to look out for. What I'm exposed to is I hear a lot of people use the word AI where it's not supposed to be used. And because it's like the buzzword for everything.
Mm-hmm.
So can you just reflect and talk on what it's not and when should we not use the word AI for the functions that are being applied?
Sure. Can you help me out a little bit by sharing with me what you mean by it should not be used, or
the word AI is overgeneralized. It's applied to anything that moves, anything that provides stimulation, and without consideration of understanding what it is. So just for clarification,
Well, so I'm not sure what examples you're thinking of. It would be helpful for me to think of examples, but I can say the word artificial intelligence is an umbrella term. It references the area of machine learning, that is systems that are learning from the data as you respond to, or as individuals respond to systems through further data collection. So as it gets new data, the system is self-correcting and reiterative. And that's one area. Another area of artificial intelligence is large system decision making using data. So it is really, I think, at its center about how quickly computations can be done with large data sets. That's the way to think of artificial intelligence. Now, where I would differentiate it is, I can tell you just 6 years ago, when we programmed the robot, we would program things such as if-then possibilities. So we would program and say, if the individual says A, B, and C, do F, E, and G. Those types of systems are not dynamic, they're not responding, they're not reiterative. So I wouldn't use the word artificial intelligence for that. But maybe you can help me out, Lena, by
No,
giving
this is
me-
exactly it. So there is a learning process through AI where data first is embedded, coded, planned, or engineered, and then there is a learning process based on future information as the robot or the system is receiving information, it's learning to adjust because
Yes.
there's new information happening. So I just wanted to add some clarification that iterative, that interactive learning
Yeah.
is part of an AI system.
Mhm.
Am I correct?
Yes, thank you for that. Absolutely. The dynamic reiterative system is what makes it so strong, and it is absolutely different than what we used to do when we would create, telemarketing systems where, the voice command had ideas about how to respond under specific things that you said. Today, it learns from the callers.
Correct.
You're
And that-
100% right.
Yeah, that's like a finite differentiation. Yeah. Okay,
Thank you.
Thank you.
We've got a couple of questions. Oh, sorry. I'm just going to go ahead and throw out one question from the chat and then let people jump in again. One person had asked a little bit maybe related to Lena's question, how we as clinicians or anyone, I guess, might classify identify what the criteria are to classify an app for speech therapy as AI. So I don't know. I feel like I will let that person jump in if they want more, but I feel like we were kind of getting into that. But maybe if there's any like real life examples, we could tie those two.
Yeah, that was me. So and I guess I can give examples also maybe that would further clarify about maybe what Lena was talking about. So an example like getting more into general medicine, like MyFitnessPal, for example, or an app that my mother-in-law she said to my husband, oh, AI now can help figure out when migraines happen because it'll graph it, based on data you put in. So I'm thinking those are not AI because they're not generating anything novel. Would that be the criterion?
So that's the reason I found Lena's question a little difficult. I think that where she's coming from, if I'm not mistaken, Lena, is that what we're seeing is the rush toward everyone saying, what I do is artificially intelligent. So if you kind of know in the digital or technology world, everyone wants to be able to say what they're doing is artificially intelligent today, because that's the next wave. And so and sometimes they're not quite there, and to know that, you would be able to test systems that are not reiterative and are not learning as responders are responding to it. And that's the part that makes things difficult. Do I think that there is an app? You know, honestly, I think a lot of apps coming out today that monitor or tell you, do you have a headache? Do you have a migraine? They're learning systems. They're actually likely to be artificially intelligent because they're learning from the responder what they're putting into the information. A lot of the fitness apps are beginning to do that. They're actually able to do a lot of those informations, and nutrition apps are beginning to do with the advancements in technology to be able to recognize what the pictures are of, because before we had to actually input, I'm having an apple, I ate a piece of cake, and then I decided to have, you know, this pizza from this place. Now we don't have to do that anymore, you know, because it actually can identify and tell you exactly what it is that you're eating. I'm not sure how good that is, but it is it is more efficient than what we used to have to do. And the part of these that makes it artificially intelligent is you literally will see at the very bottom of the systems, did I get this correct? Is this what you're having? So it is literally training as you're using the app.
A question on over-reliance, I shouldn't say not over-reliance, but feedback from individuals with whether it's my clients or the clinicians within my company. When I first introduced like an AI note-taking app for our system for my clinicians, I had a lot of people that gave negative feedback saying, I don't want to become reliant on this. And then clients, when we're introducing like maybe how to write an email and we're using Chat GPT and the adult client is like, okay, I want to write an email to this person and talk about this. I get feedback from care providers being like, oh, well, I want them to develop that skill, even though the client might be in their 40s or 50s. And I just feel like I get a lot of pushback, and I don't know whether that's the area that I live in or what have you, but what do you normally say when people give you that feedback?
Yeah, no, I think that you bring up a really important point, and that is that most of us are in work settings with 7 different generations of individuals, if not at a minimum 6 different generations of individuals. And, you know, generationally speaking, there are individuals like TV Joling, who's much older than me, but will kick my butt any day with regards to what he knows. I'm trying to keep up with him every day. But the average individual in his age group or in his generation is less probable to be using some of those systems and more likely to be wary of where this could go wrong with what they think is the speed of which things are happening. And we have to kind of understand that the generations that are coming in, like my students, honestly do not know a world where they cannot be gaming. The question of, are you gaming, is a dumb one. I used to ask that question to identify who am I dealing with in my audience. Today, it's a dumb question to ask because they all are absolutely using computer games as a part of their escape and socialization and get, you know, discussions. So I think we need to kind of realize that, you know, digital systems have come into and kind of become streamed into generationally very differently. And what I would try to do is to focus on making sure that information is accurate. I don't think, you know, in a position to encourage everybody to use these systems, I don't think it's good for me to say that they're perfect or that they work. I'd like to use them to be efficient. I can see how that can make me seem more lazy to somebody who's had to do it themselves. And what I'd like to do is to ask for their support in the accuracy. Like, am I looking at something that's not accurate? Did we generate something that I need to think twice about? So I'd like to use the word caution and kind of across generations invite what we all care about, which is good care, you know, good quality work that we put out, and to recognize that if someone's kind of feeling wary, you know, I want to see, did they identify or pick up on something I didn't think about? And I want to hear that and to invite them to think a little bit about how I'm using it. So that's the way I like to do it. But I think you do bring up an excellent point, which is it's here and we're going to feel the generation gaps if we don't try to marry the generations better together. Yeah.
Thank you. And I by no means ageism is I'm not saying that. I will say some of my people that didn't want to partake were even some of my younger contractors, but
Yeah.
Thank you so much.
No, 100%. I do think we're seeing early adopters being much younger folks. Like I know as an entrepreneur, I'm in a space where honestly, most of the people doing startups right now in digital technology are 28 years old, and I'm definitely not that age. I can tell you that. So I definitely feel the difference in what I'm dealing with in this space. But I can also share with you that my top advisors currently that use some of these systems at its highest level are actually people also above their 60s. So it is definitely, I think, depends on the experience of the individuals and their history. Yeah.
We have a question in the chat I wanted to bring up because it looks like a number of people are interested in it. Do you have any thoughts on a practicum student's use of AI while collecting hours to sit for the BCBA exam, such as relying on ChatGPT to generate a behavior intervention plan, rather than, kind of relates to this last question, developing ideas on their own? And how might supervising BCBA embrace AI but still build skill sets so that the student they're supervising can pass the exam?
Yeah, this is an excellent question. I didn't find it, but I have heard that there is an example of some AI chatbot passing the BCBA exam, and I'm not surprised. This is one way that folks are loving to show us that multiple choice examination will not suffice as a means of our capacity comparatively. Honestly, so this is Ellie. I gave you my context when I started today for a reason. I come from a history where adoption of technology and its coexistence with us has allowed me to be efficient and scale things up. I am, a proponent of embedding and using technology. So, I can share with you what I talk to my students about, which is I encourage them to use it. And I tell them I hold you responsible for the content, meaning you are at the end of the day responsible for the accuracy of the information. And I teach them how to critically think about what it generates, much like I shared with you what DALL-E just, put out, or what Night Cafe put out. I'll put in prompts and show them what are some of the things that'll come out and how it may sound sophisticated. And AI generated written text is very authoritative. So it sounds like I am correct. And I go through and show them how in their generation, they're going to have to actually go against those things, not the way we had to in many ways by going against authority sounds that way, but that they have to kind of really take it apart and begin to think about the parts and pieces of how to use it. So it's good as a friend. We could never stop people from talking with each other. We do oral exams here at CSUN. I've never been able to stop the students from standing in the hallway and sharing with each other with their experience and the nightmare. And I'm not going to be able to, stop them from using assistants. And I really think of artificial intelligence as just another assistant in the room with them. My goal is to have them think for themselves and to learn how to use it so that they're thinking stronger and they're questioning things. That's where my focus would be as an educator and as a mentor. So that would be my answer. I hope I answered the question.
Dr. Kazemi, I see we do have a couple other questions in the chat, but I also see it's about 16 past. So I will let it be your call if you want to try to answer one more, or just have this be your cue to go, since I know you have to teach your class.
Yeah, sure. No, I'm literally gonna drop off at 5:20, close my laptop, put the lights out, and run. So
all right. Well, one person also put in the chat that they are worried about wondering about whether kids in particular may need more direct interaction with people directly versus and with materials to learn some skills in general. Can they really learn through virtual activity, or do people need to actually touch and feel in their environment? They mentioned new to the public school, they worry that kids are moving their bodies less and interacting with screens a lot more.
yeah. Well, I do think that that's an excellent question. And I think it's upon all of us, right? Even with the gaming world, we're not addressing the issue of how many individuals are actually sitting, how many hours. They're creating better and better chairs. I don't know if you've all become aware of the fact that they're creating like almost prosthetics, things that'll move the person's limb some more as they're doing things. So there's absolutely, this is upon us. And I was speaking with my good friend Antonio Harrison, who is a behavior analyst who used to be a coach, and he's doing you know, some of the athletic activities for metaverse. And he was saying that there are individuals who get dehydrated and pass out from being in a headset from the number of hours that are in there. So they're beginning to, and all that the gaming world and all the virtual world is trying to do is duration of hours they can engage you, right? That's all they want, is how long can I keep you in here? And with that, we have some real things to think about as we move forward. To be honest, I'd love for serious games or training to be that interesting for people to want to stay in there for that many hours. We're still working on getting better as serious game developers. But you know, I do think that we're going to have to figure out how to create a world where people are active. And I think we're going to see a system shift between the things we create activity for versus being in virtual headsets and computers and whatnot. I think this is upon us. To also, for your other question, I actually want to apologize to Lena. She had an excellent question about a system that's come out, sort of, I would call it sexting or flirting devices that have come out. And a lot of times they actually commercialize and target individuals on the spectrum. So neurodivergent individuals are definitely being targeted for a lot of these technologies that are coming out. And they're very, you know, rudimentary early stages. And some individuals will report, well, it's kind of fun because I can test out what I'm going to say to somebody else. And I can see that, you know, you've gotten a role play and you can now test it out and say it to somebody else. Some of the dangers of that is that you've got agents in these worlds that are not giving you corrective feedback or real feedback. So some of the things that they are trying, they're not going to really get a sense of. Nobody's going to want to hear you say that. So I think that if we can get involved with some of these systems rather than just watch them develop you know, without our science and knowledge, we would be in a much better place. Because I do think that there's potential for some of these systems to be fun and to provide with feedback. You know, but maybe that's the reason that individuals like it, sort of, you know, the idea that they like being able to just put their behavior out there without getting any correction. I'm not sure, but there are some dangers with regards to the populations being targeted and who's developing what. So learning about the system more and identifying what that does for the individual is important. I do think, you know, I stand behind my earlier statement also. The human care services is about to change, and I think our world as a whole is about to change. I think we're going to re-question what is neurodivergence, you know, when we are communicating with each other quite often via these computer devices. And, you know, what does our interaction need to look like? What does human interaction look like in the future? So I think we're gonna have some interesting things coming up for us to consider, because it shapes us back. But I think I would say test it out, get in there and see what you think. And if you're the one gaming or getting in a headset for so many hours, put a timer on and get out and drink something. Go for a walk.
Thank you so much, Dr. Kazemi. This has been an incredible presentation, and I love all your thoughts we got into with the great questions that were brought up.
100%.